Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. The Honorable all of the juries, the Honorable all of the participants, and my beloved friend. First of all, I would like to thank Allah Subhanahu wa Taala who have given us guidance. Second, salawat and salam to our Prophet Muhammad Sallallahu Alaihi Wasallam who has guided us from the dim to the brightness. Third, I would like to thank everyone. I am Amalia Andi as the representative of 22 Senior High School Makassar. This time, I would like to deliver my speech entitled Distribution of Vaccines in Education Sector. Ladies and gentlemen, as we know, 2021 is different from previous years. This year, we are in situation of the COVID-19 pandemic which has directly affected the education systems around the world. Schools are temporarily closed. United Nations Educational, Scientific and Cultural Organization UNESCO data knows that more than 19% or about 1.3 billion of the world's student population must study from home. Nearly a generation of education has been disrupted in the world. This is also an impetus for the government in Indonesia to make efforts to minimize COVID-19, especially in the field of education, one of which is by vaccinating. But before that, anyone knows what a vaccine is? Vaccines are substances or compounds that function to form immunity against a disease. Vaccine content can be in the form of bacteria or viruses that have been weakened, or killed, or part of the bacteria or viruses. Vaccines can be given in the form of injections or drops or through steam aerosol. Vaccination is important as a form of self-protection against disease, especially during the COVID-19 pandemic. As an effort to minimize a COVID-19 exposure, especially in the education sector, the government undoubtedly makes the education sector a vaccination priority to recover the education system. This is to ensure the right to learn, one of the basic rights of children, can still be fulfilled, especially in areas with limited internet access. Ladies and gentlemen, then how is it going to implement it? The Indonesian government has started vaccination for teachers and educators at all levels of education in public and private education units, which has been given in stage starting from educators and education staff according to stage of administering the vaccine. The first stage of vaccination is carried out for educators and education personnel at the kindergarten, primary school, junior high school, and equivalent levels. Then the second stage is for educators and education staff for senior high school, vocational school, and equivalent. The third stage of vaccination for educators at the higher education level. Secretary General of the Ministry of Health of Skar Primadi say, as of Wednesday on 9th June 2021, the number of teachers and educators who had been injected with the first dose of the COVID-19 vaccine was 1,766,751 people. Meanwhile, 1,095,000 teachers and educators have been vaccinated against the second dose. The second dose of vaccination is 1,095,000 enough for 1.5 or percent running, and the second dose is only 19.4%. Furthermore, evidence from the government in prioritizing the distribution of vaccinations for the education sector is President Joko Widodo urging the vaccination program for junior high school and high school students to be accelerated so as to create communal immunity and avoid the COVID-19 pandemic. The President appreciates the activities carried out for 15,000 junior high school students and 15,000 high school students in 14 provinces, including DKI Jakarta, Banten, West Java, Central Java, East Java, Papua, Yogyakarta Special Region, South Sulawesi, North Sulawesi, West Sumatra, Riau Islands, Kalimantan, and Bali. National Immunization Expert Advisory Committee and COVID-19 Vaccine Approval PT Bio Farma Sinovac at the age of more than 12 years from BPOM itself has allowed vaccination for children aged 12 to 17 years. Meanwhile, the mechanism of administering the COVID-19 vaccine for this age range, among them, one, vaccination can be carried out at health service facilities or at schools or madrasa or Islamic boarding school in coordination with the education office and the local MORA office. This is useful to facilitate data collection and monitoring of implementation. Second, the technique of screening, implementing, and observing vaccinators for age 12 to 17 years is the same as vaccination for those aged over 18 years. Third, using Sinovac vaccine dose of 0.5 milliliter. This government vaccination program gives new hope to the community to choices with COVID-19, especially in the world of education. It is hard to imagine if the world of education continues in this condition for the next 10 years. The implementation of the distance learning system is currently considered effective without being accompanied by the readiness of curriculum learning methods and supporting interactive telecommunication facilities. The difficulty of the facility mainly occurs in remote areas with unfavorable geographical conditions. In addition, the economic capacity and knowledge of the community are limited of the availability of internet media and its supporting facilities. With this, I hope and we all hope that with this vaccination we can minimize COVID-19 suffers and the teaching and the learning process can run as well as before. That's all from my speech. I'm sorry if there are words that are lacking in the hearts of all my friends, and I'm sure what I say this time is very useful for all of us. Wassalamualaikum warahmatullahi wabarakatuh.